In today's mini training, I'm going to talk about homeopathic remedies for acute diarrhea. Now, you know that there is a practice of most homeopaths to give arsenic alb for most cases of diarrhea. Even I used to do that. Now, alb is a wonderful remedy and it will act quickly and efficiently whenever it is indicated. But in homeopathy, there are several remedies equally wonderful as arsenic alb, and they will all act well when it is indicated. So you can see there are numerous remedies for diarrhea. But today's video, I'm going to focus on acute diarrhea, and in today's video, I'm going to talk about these 7 remedies: arsenic alb, Veratrum alb, China, Aloe, Mercurius, Argentum nitricum, and Croton. Welcome to Virtual Homeopathy, and I am Dr. Reshma Nizam. Now, if you look at the causes of acute diarrhea, it is often caused by infections, food intolerance, food poisoning, and certain medications. Whereas chronic diarrhea has much deeper pathology like inflammatory bowel disease, irritable bowel syndrome, celiac disease, colon cancer, etc. So, I'm going to begin the series with arsenic alb itself. Arsenic alb patients will have diarrhea soon after eating or drinking. So after eating or drinking anything, they have to pass the stool. And at night also, they have to wake up, mostly between 1 to 3 a.m. The diarrhea is more during 1 to 3 a.m. The character of the stool, arsenic alb patients will pass only small quantity of stool, but it is highly offensive. So they pass small quantity of highly offensive stools. These patients are very weak. They are very prostrated. They pass only a small quantity of stool, but they experience great weakness, and they also have pain abdomen. More importantly, they have burning sensation in the rectum and anus. Now, this burning sensation is a very important feature of arsenic alb. Now, arsenic alb patients will have burning sensation in the rectum while passing stool, and in the anus after they pass stool, they will have burning sensation. These patients are thirsty. They'll ask for sips of water, but the patient may not be able to tell you that they have thirst for sips of water. Just remember that arsenic alb patients are thirsty and they are also chilly. Mentally, arsenic alb patients are anxious and they are restless. So this is the feature of arsenic alb. Now, arsenic alb diarrhea is usually caused by contaminated food. Food poisoning, you can consider arsenic alb. Another remedy to remember in this context, that is, another remedy for food poisoning is carbo vegetabilis. That's about arsenic alb. Another remedy resembling arsenic alb is Veratrum album. In arsenic alb, you saw that patients passed small quantity of stool, but in Veratrum album, you will find that they passed profuse stool. Just like in arsenic alb, Veratrum alb also has pain abdomen. They have pain abdomen before passing stool, and they pass profuse quantity of stool. Now they will have weakness after passing stool. Veratrum alb patients, they pass profuse stool. So they have some symptoms resembling dehydration, closely resembling dehydration. What are the symptoms of dehydration? When a patient is dehydrated, they usually will have muscle cramps, they'll be thirsty, they'll have fever-like symptoms like they may be feeling cold, they'll break out in a sweat, they may feel chilly, then they will be very weak, dizzy, confused, they'll pass very small quantity of urine. So in Veratrum album, what are the symptoms resembling dehydration? What are the symptoms that you will find in Veratrum alb patients? They'll have cramps, mostly in the legs, calf muscles, they'll have cramps. They feel that their whole body is cold. They'll break out in a cold sweat and they'll be thirsty. And they are very thirsty, Veratrum alb patients. So these are some of the symptoms of dehydration that you will find in Veratrum album patients. Veratrum album patients can also have nausea while they suffer from diarrhea. When they have acute diarrhea, they can also have nausea. In such a patient, passing profuse stools and having pain abdomen, weakness and symptoms similar to dehydration, you will expect them to be anxious and restless. However, unlike arsenic alb, Veratrum alb patients are not anxious, they are not restless. So that's about Veratrum alb. When a patient comes to you with painless diarrhea, one remedy you can consider is Cinchona. Now, Cinchona patients, they have painless diarrhea. Cinchona patients, another condition for which you can consider Cinchona is when patients suffer from acute diarrhea after acute illness. Maybe they had an attack of fever, an influenza, and at the end of the illness they developed diarrhea. In that conditions, you can consider Cinchona. So, Cinchona patients will have to pass stool immediately after eating and at night. And they are also thirsty and they are weak. So, these are symptoms similar to arsenical. But Cinchona, it is painless, whereas arsenical, they have pain in the abdomen, they have the burning sensation in the rectum and anus. Cinchona is painless and they will also be passing undigested stool. In chronic diarrhea in old people, again you can consider Cinchona, where it is usually painless. So diarrhea after acute illness, and in old people when they have chronic diarrhea, mostly painless diarrhea, you can consider Cinchona. A remedy for painful diarrhea, that is Mercurius. Mercurius is a very important remedy for painful diarrhea. Now, Mercurius patients have two main symptoms. They have to strain for stool, they have to press hard, they have to strain for stool, and the other is the pain. Mercurius patients, they have pain abdomen and they also have pain in the rectum. Now, in spite of straining for stool and in spite of bearing all that pain and putting in all the effort to pass stool, Mercurius patients will only pass small quantity of stool and it is usually bloody. Now, these Mercurius patients, even after passing stool, they will feel as if it is not finished. So, they have this constant urging to stool. They will feel that it is not finished, but when they go to pass stool, they have to strain and they have to suffer all that pain. When the patient have involuntary stool, the remedy to remember is Aloe socotrina. The Aloe socotrina patients, they have incontinence of stool. Whenever they pass flatus, they will feel that they have to pass stool. And this Aloe socotrina patients, they have lots of flatulence and they have this constant desire to pass stool and they have the constant desire to pass flatus. So when they pass flatus, there will be involuntary emission of stool as well. Even during urination, they will pass some amount of stool. Now, these Aloe socotrina patients, they also have pain abdomen before stool and during stool. Before stool, there is pain in the abdomen. During stool, there is pain in the abdomen. But after passing stool, this pain is better. So, for incontinence of stool, one remedy you can consider is Aloe socotrina. And Aloe socotrina patients will pass flatus also. They have lots of flatulence. Next remedy is Croton tig. In Croton tig, there is actually sudden expulsion of stool. Now, this patient, Croton tig patient, they will have this urging for stool after eating anything or drinking anything. After they have their meals or when they drink something, they have this urge for stool. So, they go into the toilet and when they sit down, the stool comes out suddenly and violently. Also, when the patient moves moves their body, they have this desire to pass stool, and when they go to pass stool, it is actually sudden expulsion of stool. So after their meals or after they drink something or when they move, they have this sudden expulsion of stool. Croton tig patients will have sudden expulsion of stool. Now, before they pass their stool, they may have pain in the abdomen, or sometimes it is actually a gurgling sensation in the abdomen. They'll feel that there is some flatus and they'll feel that gurgling sensation in the abdomen. And the stool they pass is yellowish and it is watery stool. They pass profuse stool, yellowish watery stool. So sudden expulsion of stool after meals, after drinking, after motion is a characteristic of the stools in Croton tig patients. And gurgling sensation and the profuse watery stool is present in Croton tig. Whenever the patient have diarrhea after eating sugar or after candies, the remedy is Argentum nitricum. So Argentum nitricum patients will have diarrhea after candy or sugar. And the stools are usually greenish stools, and Argentum nitricum patients will have lots of flatus. Just like Aloe socotrina patient, they also have lots of flatus. When during diarrhea, these patients eat anything sweet, again they have this desire to pass stool. Can follow me on Instagram where I post contents related to practical homeopathic therapeutics. If you like this video, give it a thumbs up. Subscribe to this channel because I'll be conducting many webinars like this every week. Turn on the bell icon for notifications.